Good evening, everyone. It's great to see all of you after all these years. For those of you who don't know me, I was an intern and resident at Harlem beginning in 1974, served as chief resident with Rick Sims in 77, 78, then did a hematology fellowship, mostly with John Lindenbaum, and then stayed on as an attending. In 1989, I left Harlem to move, at the suggestion of Dr. Mary Bassett, to Zimbabwe. After about 6 years of working and living in Zimbabwe, and then in England, I returned to New York, and among other things, resumed many of my duties here as a hematologist at Harlem Hospital in the late 90s and early 2000s. My first experience at Harlem Hospital was a second-year medical student from Columbia in a group of 4 students learning physical diagnosis in 1972. Dr. Felton and Dr. Marquez were our instructors, and as an escape from the basic sciences, which I didn't enjoy very much, this rotation was a really happy, liberating experience. Doctors Felton and Marquez were very careful, patient instructors, and we all appreciated it. The most important event in that period, however, was the evening when the senior resident on call, a guy named Joe DeGrosse, invited me to round with him on all of the newly admitted patients that he was seeing. This was pretty wonderful. I heard inspiratory basilar rales and felt increased fremitus in a man with lobar pneumonia. I saw how an ESR was performed. I watched the residents taking care of a woman with massive variceal bleeding. I heard wheezing in an asthmatic, and I was even shown hypersegmented neutrophils through the microscope in the 14th floor hematology lab. I noticed how demanding the residents' work was, but I also noticed their ethnic and social diversity and how much they seemed to enjoy their work with great camaraderie, great humor, and a real sense of purpose. For the first time in medical school, I really felt at home. Repeatedly that evening, I heard Dr. DeGrosse and the other residents anticipate what might happen at morning report the next day, saying things like, "Oh, the jet is going to like this," or "You better get your story right for the jet," or we better do this for the jet," or "The jet isn't going to like this." Finally, as I was about to go home, I asked the residents, "Sorry, but just who is this guy, the jet?" And one resident responded with words to the effect of, "The jet is our new chief. He's Gerald E. Thompson. He's a young guy. He's a nice guy. He's very, very smart and very, very tough. He holds this place together, and we don't mess with him." I returned to Harlem about a year later to do my student clerkship in medicine. I was assigned to 12 North, where the wonderful Miss Thorpe, speaking of the nurses, was the head nurse, and Eric Vanderbush, a great friend, was my resident. Our student group presented to Dr. Thompson once weekly. I discovered that the man they called the jet was about as kind and patient as a person could be. He could speak quietly and wisely on any subject presented to him. Mostly I saw a wonderfully intelligent man who cared about patients and about his trainees, and who never raised his voice or indulged in sarcasm. He was a consummate gentleman. The following year, after a sub-internship in the ICU with Dr. Jurgen, I knew what I wanted to do. In '74, I began my residency at Harlem. As residents, our main contact with Dr. Thompson was in morning report. That resident I met that previous evening was right. Nobody wanted to mess with Dr. Thompson. He listened quietly to our presentations. He then asked lots of questions. He never raised his voice. He could teach us the meaning of a diastolic murmur or tender hepatomegaly. He showed the segmental anatomy of the lung as it related to a patient's radiographic findings. Of course, as a nephrologist, he loved to discuss metabolic disorders. Just in the past month, as preceptor for Columbia students at the Bronx VA, I taught them the utility of the anion gap and the importance of the urine sodium. A couple of things that Dr. Thompson taught all of us at Harlem 4 decades previously. Of course, I thought of Dr. Thompson as I taught these things. He taught by asking questions and making sure that we learned the answers. He didn't have to raise his voice or invoke sarcasm. As I saw it, however, it wasn't just to teach us how to interpret x-rays or BUN and creatinine values that he occupied that office on the 14th floor. Above all, he was there because this hospital was standing in central Harlem. Although he didn't talk about it much, he believed profoundly that people of color, the poor, and the disadvantaged deserve compassionate and high-quality medical care as much as anybody else. On leaving Harlem, he didn't abandon his beliefs. He has many honors, and he's had many titles since he left Harlem. But what's most striking to me when I read his CV was he was asked to chair committees reviewing the role of physicians in the inhumane and cruel treatment of a group of our country's most despised people, Muslims, jailed and tortured after 9/11. When I became an attending, I started to go to faculty meetings. Dr. Thompson would stand before us at the front of the second floor auditorium. He would tell us about some of his experience as the chief of medicine. Until then, as a resident and chief resident, I had thought that yes, he had a tough job, teaching residents and students, running the training program, hiring new faculty, watching over the dialysis program, supervising office staff, keeping his secretary happy, and staying on the right side of Jay Brown. Now in the faculty meetings, I understood that there was ever so much more. He described his meetings with hospital administrators who were constantly changing, meetings with the Health and Hospital Corporation, politicians, the media, discussions with the dean's office at Columbia, and interactions with the ABIM. He would speak without a mic or any notes for 20, 30, 40 minutes while we remained speechless, just listening. Dr. Thompson seemed a political and administrative gymnast. John Lindenbaum told me that he always found the meetings to be such an interesting experience. For me, they were almost mystical. In my own career in New York, Africa, and England, I've always looked back on my time at Harlem with gratitude. I knew so many great people, patients, nurses, students, administrative staff, and colleagues. As residents, we all had to face plenty of challenges, many difficulties, but we received so much great teaching and support. More than anybody else, it was Gerald Thompson who made this happen. Again, that resident was right. He held this place together. He assembled and sustained a great faculty who, despite all of their many idiosyncrasies, were here to look after patients and to train us. He ensured that we had support from nurses and ancillary staff, and with great difficulty, he extracted as much service as was humanly possible from the Department of Radiology. His efforts with local political leaders, the Health and Hospital Corporation, and the Columbia Dean's Office provided the administrative and financial support to keep the department and the hospital going. With limited resources, he supervised and ensured funding for an enormous training program of more than 130 residents and fellows. I've never respected anybody more as an ethical and compassionate leader. But as residents, we knew him mostly as our teacher. As a teacher, he was an artist and remains my #1 role model. He was a consummate leader and teacher, and he remains a consummate gentleman. We can all feel forever blessed that he was the chief of medicine at Harlem Hospital. He was our chief. Thank you, Dr. Thompson. And may you and your family always be as blessed as we were.